So good afternoon, everyone, and welcome to another Let's Talk Connection Community Conversations with leaders in the mission-driven sector and the for-profit world. We're very excited and happy that you've been able to make time to be with us today. Today, we have the pleasure of a board member of the Community Foundation, as well as Tompkins County Director of the Health Department for Tompkins County and the Mental Health Commissioner, Frank Kruppa, who is with us almost a year to the day when he was with us last year on March 9th, 2021. And we are going to be talking about the variety of concerns and challenges, opportunities, and solutions around mental health. So Frank will have some information to share with us, but go ahead and get ready with your questions, put them in the chat box, and Samari will begin to bring those to our attention when we're ready. So Frank, I'm going to turn it right over to you so we have as much time as possible for our conversation today. Go right ahead.
Great. Thanks, George. And thanks everyone for joining this afternoon. I've got a few comments to make and I'll try to keep them as succinct as possible. I saw some of the questions that came in ahead of time and there's a large variation in subject matter that folks want to touch on. So I want to make sure we leave lots of time for questions from the group so we can cover as much areas of interest as possible. As a way of introduction, my name is Frank Kruppa, and as George said, I am the Tompkins County Public Health Director and Mental Health Commissioner. I've been doing both roles now since 2015. One of the exciting things that's happening for us at the two departments is we're undergoing a merger. The legislature back in 2019 voted to formally bring the two departments together. We had grand plans to do some pretty exciting things in 2020 that got a little bit side railed with other subjects that we won't mention today. But we're getting back into the thick of that now. And so there's some exciting work going on around addressing the whole health of individuals, addressing mental health, physical health, emotional, behavioral health, all of those things in as holistic a manner as possible. So we're excited that work is back underway. We've engaged in a branding exercise to create a new name, logo and kind of, front face for this new department. So we're excited about that work and to see the results of that coming soon. So, keep your eyes out for that as it unfolds. As we're talking about mental health issues in our community, I think the first thing we have to start with is demand is up. I think the results of what we've all been through for the last couple of years, it has really had an impact on the needs in our community across the spectrum, from children to youth to our geriatric patients. All are needing more service. Some are seeking services for the first time. So there's a wide array of need. And to be completely honest, we can't meet that demand right now. There's just not enough resource. And it's not necessarily, that more money would just solve the problem. We don't have access to professionals that are, licensed or trained to do this work. There's just not enough of them. And there's an extremely competitive market right now, as there is for a lot of professions, particularly in healthcare. So we are challenged to have, enough and the appropriate staff to meet the demand. We're working at it. You may have seen back in December, the mental health department, we did put out a press release about standing down our intakes. And that's not something that clinics normally do, right? So I know there was a bit of shock when folks heard that. And honestly, that was part of the goal. As we wanted to make the community aware of, the significance of, what we're facing right now. Typically, if a clinic is, running behind, they'll just make appointments further out into the future, or they'll create a waiting list. They don't necessarily make a public announcement that, they're in this situation. But because we are the public mental health clinic and we are a safety net, we thought it was important that our community know where we are. Now, when we say we were, standing down intakes, we actually only stood down about 40% of our intakes. We would never stop addressing crisis situations in that moment. And anyone that walked through our doors or made a call to us was triaged and if there was a need from, because of their particular situation to get them care, they still got care. So I want folks to know that it wasn't as if we shut the doors to new folks. We really were just scaling back. And the reason for that need was we lost several staff all at once, most of them to retirement. We've been very fortunate to have some long-standing staff working at the department, and they earned their retirement. And so it was time for them to take advantage of that. We had some folks leave for other positions that were advancements for them, and we wish them well in those endeavors too. But it put us in a position where we wanted to make sure we could care for the people that were in our care already and make sure that our community knew kind of the extent of where we are. I'm happy to report that we've reopened all of our admissions, so we're back up to our normal levels. We did that towards the end of January, and things are starting to go well. It doesn't mean we've filled all of our staffing needs. We're still recruiting for more staff, and so if you know therapists, nurse practitioners, psychiatrists, we'll take any and all kinds that have interest and want to talk to us about a potential career opportunity with us. So demand is up. And we have work to do to figure out how to meet that demand. And I'm talking about the mental health department specifically, but I think across the system, as I talk with our partners in the community, we're all facing similar issues. So the demand is outpacing the ability to meet it. And we're all working hard to try to scale up to what works. Some other things that have been going on, I think that might be of interest. I think I saw Scott McLeod on here from the Sophie Fund. Our Suicide Prevention Coalition is doing great work. They've created a strategic plan for the community that we'll be working on in the coming months and years. So some exciting work going on there as well. Children and youth, a lot of the questions that I saw were directed about children and youth and where are we for them? And I think it's clear that there are needs, and the last couple of years have created new significant challenges for our youth, and we need to figure out ways to support them. I can tell you we do have clinicians that work in most of the districts where we're actually co-located in the schools. And so we're able to provide therapy services right there during the school day in the community, trying to make it as easy and accessible for families as we possibly can. We're not meeting the demand there either. There's always more kids than we have slots for. And so we're looking at ways to try to expand that. Most of it is driven by the ability to find clinicians to add to the team for that. Ithaca City School District, we joined back in providing those services for some of their school buildings just ahead of 2020. And there's definitely interest in expanding that, and we're talking with them and looking at more ways where we can provide therapy services right there in the school. I would say that our therapy services are just probably a small piece of the puzzle on what we need to do for our youth and supporting them. And there were a lot of questions about what specific districts are doing. And I don't know that level of detail. And I would certainly encourage folks to reach out to their school district if they have children there or have an interest in what's going on to find a bit more detail. But I think across the board, there is a recognition that we're going to have to do more to support our kids after the last couple of years and what they've been through, and trying to get them back to the baseline, pre-2020, and then dealing with the issues that we had pre-2020 in our youth and children's populations from a mental health perspective. So there's definitely lots of work that still needs to be done on those fronts. I can't talk about mental health without bringing in substance use disorders, right? And the co-occurring nature of those. And so we work very closely with our substance use disorder partners in the community, CARS, the Alcohol and Drug Council, Reach Medical, our hospital, trying to make sure that, as we're addressing people's mental health issues, that if there are other issues, including substance use disorders, that we're figuring out ways to get those met. And that goes the other way. If somebody presents to our substance use disorder providers, they're looking to provide as much support from a mental health perspective as well, and then linking them up with other providers in the community. There's a lot of work that still needs to be done there. That's kind of the theme of today, is there's still much to be done. But I think we're heading in the right direction, where our system is starting to look at people holistically. That's why I'm so excited about the merger of the two departments from public health and mental health. But I think it's even broader than that, because we're starting to have conversations to say, we need to address people where they are for the totality of their needs, and make a system that meets those needs, versus having them try to navigate multiple systems that might not be interconnected or communicating or connecting effectively. So excited about a lot of that work to be done. And then I think both times that I've done this, if I remember correctly, one of the questions that George posed was, what can the community do to help and support? And, the first thing that I would offer is, we have work to do around stigma with mental health issues. And we need to talk to our families and our friends about mental health issues the way that we talk about physical health issues. If somebody has a cold and we see that, we talk about that. How are you feeling? Do you need help getting to the doctor? Is there something I can help? Can I bring you some chicken soup? Right? Those same type of interactions, we need to be having them around mental health. We as individuals feeling comfortable to talk to our friends and family about our mental health issues, as well as, being able to identify them in those that we love and surround ourselves with. So, as a community, that's a big part of it. And I think some of that has started to happen. If anything positive came out of the last couple of years, I think we've had some very open and honest conversations about mental health and how it impacts everyone. And it's not this thing that's taboo, or that, only really, really, sick people have. Everyone has, some mental health issues at some point during their life, and we need to feel comfortable seeking out help and services for those. So, help us start having those conversations. It starts at home with our friends and our families to start, addressing the stigma and making it more appropriate to talk about those concerns. And then when we know about them, we can start helping people get access to the many services that are available. So I'm going to go ahead and stop there, and hopefully we can have some robust questions answered.
Great, Frank. Thank you so much. There's so much to get our arms around. This Let's Talks are meant to be a beginning introduction. There'll be conversations that happen from here. And Samari, as you're beginning to look at questions, one quick question I have for Frank is, can you put a little more detail on the demand? Are you seeing different sorts of requests, or first-time connectors to the system, elders, rural folks, youth? Can you define that increase in demand a little bit more? And then we'll turn it over to Samari.
Yeah, I think it's all of the above, George. I think acutely, we've seen people with more significant needs presenting. So, when someone comes to our doors, unfortunately, they're further along down their path and need more direct, significant care.
Mm-hmm.
But we've also seen a lot of first timers, people that have, for the first time are entering the mental health system and seeking care. And that's a good thing. And it's important that we make sure that we're there to receive those folks, because we want them to have a good first experience. So hopefully there will be continued reach outs, throughout their life. As far as demographics across things, that's a little bit harder. But what I will tell you is, we're not very good at reaching our traditionally underserved populations. I think I can say that pretty clearly without having to look at any data. And that's a big part of what we're hoping will come out of for the department's perspective, this merger conversation, because
Mm-hmm.
foundational to that merger is health equity, and wanting to make sure that we are hearing voices that we don't normally hear from, so that way we can understand how to better serve people that we might not be serving now or might be underserving.
Great, thanks. Samari, turn it over to you for comments in the chat or other questions, whatever you'd like to pitch to Frank.
Okay. Sorry, is there an echo? I'm sorry. I'm
You're fine. You're fine.
Okay. Well, thank you, Frank, for that. Like Frank mentioned, there were a lot of subjects and a lot of areas of interest in the questions. I'm gonna first go into the chat because there were like one or two main questions. So Ed would like to know more about like Suicide Prevention Coalition. He wants like information pertaining to it because he feels like the suicide prevention services in Ithaca aren't really where they need to be. So can you speak on that at all?
Yeah, I would certainly agree that there's definitely work to be done. And I mentioned that we do have a fairly strong suicide prevention coalition now. They've been working over the last several months to create a strategic plan for the community to move forward around suicide prevention. We are actually working to try to provide some additional funding to our suicide prevention and crisis line as we prepare for the transition to 988, which, if you're not familiar, the federal government approved the adoption of 988, which is essentially similar to 911 or 211, but this is specific for suicide prevention and crisis, which would be the same across the country. So no matter where you were, you could dial that same number. So there is a lot of work going on. I will tell you, I've been a bit out of the loop on that. Harmony Friedlander, our deputy commissioner, has been working with the team at the coalition to put some work together. We can certainly get some information out through George and the foundation about the plan that's come together and some of the work that's been going on there for folks that are interested.
I want to thank Scott McLeod for posting some information in the chat as well, including some links to a training coming up and the ongoing work, the important work the Sophie Fund is doing on this particular issue. Thank you, Scott.
Okay, so the next question, well, firstly, the questions that were submitted to both Amy and I through registration came from a lot of the attendees who are both parents and or mental health professional, and they're really worried about the youth, as Frank mentioned. So one of the questions was, how can we implement resources or try and expand them, especially for those who are seeking them, who like really need the help? And by that, we mean like people who are seeking them currently, but are on the wait list.
Sure. So I think there's a lot to unpack there. I'll walk backwards, on the wait list component. There are many providers in our community, and so I would certainly encourage folks, if they've been on a wait list for a while, to look around. There might be other providers available. I can tell you that the mental health department, we try to do intake same day, next day for folks that are seeking care, because we want to be able to have at least that initial contact when someone is seeking us out, to find out where they are. And for some folks, we need to get them in right away, right? They might be crisis or borderline crisis, and we want to avoid, any further needs and get them into care as quickly as possible. Others, it might be a little while before they get that next appointment, with their clinician. So it really is a, kind of a triage approach, but I would encourage anyone that, feels like they need immediate care to call the mental health department and get that process started and talk with our intake folks and see what we can get rolling. And then of course, the suicide prevention and crisis line is there for anyone that, feels like they're in crisis. As far as children and youth, I think that was the beginning of the question, Samari. Yes, I think there's a lot that needs to be done. I can tell you, we are looking, as I said, to try to expand our reach into our local schools. I think there's work in our school districts that needs to be done. And I would have, if you're a member of a school district, I would have conversations with your school board and, find out what their thoughts are and their feelings about how to better, meet the needs of our kids in the school systems. It's going to vary from community to community. Resources vary from community to community. And so, those local conversations are a big part of it, but we need to make sure that those decision makers know that we think this is a concern. So that's what individuals can do. What we're doing as a, kind of as a department is engaging with our school districts and trying to understand where they think the priorities are for their students and figuring out ways to bring services there, whether it's services we provide or connecting with community partners that might be able to bring things to bear. It's not a simple issue, and I don't want to make it sound like it is, or that there's really a silver bullet that will solve the problem. I think it's going to take a lot of community conversations, parents being engaged with their districts, and the professionals that work in those districts about how best we can develop programming and supports for our children and youth.
Thank you. The next question, so there's a lot of emphasis on youth again, and we know Ithaca is a big college town school place. So the question is, are there periodic quantitative measures like surveys, anything that are taken for Ithaca students, and how often, if that is available?
Yeah, so I think it depends on the institution, what their approach has been. I know Cornell had a work group that presented some ideas to the university, some of which I believe they've implemented, and others they're still considering. I think each of the institutions has a different approach about how they gather their information from students about their needs. I don't think any of them would say everything's hunky-dory, right? We've got it all covered. I think there's a general understanding that there is more need for our our higher ed populations, and how best to meet those. And our higher ed environments are they're structured to create some pressure, right? It's as part of their educational process, and I think all of the higher ed institutions are trying to figure out how to balance that with caring for students, making sure that their mental health needs are met. Not only providing resources from a clinician availability perspective, but how do you build the system that doesn't create the need for those that are coming to the higher ed institution. So it's a big question. I don't have the answers for those, and I honestly, their processes and their way of reviewing what their students needs. We're on the periphery, and we certainly provide input. And if we see things in the community that are being impacted because of the needs, we certainly are communicating those with them. But I think there's a lot of effort of trying to figure out how do we provide service to the appropriate levels to our higher ed students, and how do we adjust the environment to give the rigorous educational experience that's expected, while at the same time, supporting them to be successful both in their education and in their mental and physical health needs.
So Samari, I know you have to blast out of here to get to your class. I want to thank Samari Hall, one of our 5 outstanding, fantastic community impact associates who are work study students who we engage with at Cornell. We've been with these folks all year, and we're so excited and pleased that you could be part of this, Samari, and we'll get you to dip into future Let's Talks as well. So busy Cornell students need to do what you need to do, and appreciate you making time today to be here.
Of course. Thank you, everybody.
Bye.
Bye.
We have more time together with us as a group today until around 12:30. So Amy's going to take over questions. You can continue to put questions in the chat box. There's amazing amount of resources also people shared in the chat. So you can take a look at links and other suggestions. Our work and the Let's Talk programs here are relational. And we're very happy that you're here to gain information, but also to share and offer information. So Amy, I'll turn it over to you for the last couple of minutes.
Yes, and I would echo that exact sentiment. Is please continue to put in the chat your own perspective on what other resources and your own knowledge. It really expands it for all of us. A question is, could you just talk a little bit about creative ways to support folks, given, as you've already said, that there's most likely not enough licensed professionals to meet the community needs in mental health?
Yeah, we're looking for those creative ideas, right? And I think what you're seeing in the chat box is it's not a single organization or even just the service providers of, licensed clinicians that are out there to support our communities. We have many community organizations that do support people in many different ways, and we're so thankful for them. And I think really that's the creativity that we're looking for is where are people that we can meet them where they are, and what are their particular needs, and are there trusted sources that we can use to help support them. So it may not necessarily be about providing a service to the individual, but providing support to an organization that supports individuals, right? So what do I do if I have someone that's expressing, suicidal thoughts, or has told me they're, suffering from depression? What do I do? How do I support them? And I think there's a lot that can be done. I think there's a lot of information out there in our community. 211 is a great resource if you're looking for something particular about all the different resources in the community. And I think there's opportunity, there to learn more. And of course, I think we as a mental health community have to do a better job of sharing and explaining what we know and what resources are available to folks. And then I think I would say again, each of us has an opportunity to help with stigma and supporting each other, right? It doesn't take much to be kind. And that's really what we're looking for is to be kind to one another, reach out, understand that we all have different paths that we're walking, and never think that what somebody is going through, right? Everyone is experiencing different things. So have those open conversations where it's appropriate. Talk to your family and friends, about what's going on and what their needs might be. And then, let's have conversations about, what we can do to support that. And if there's, services that don't exist that we need to develop and be creative about, let's do that and let's figure it out as a community.
Very well said. Great reminder, great encouragement for all of us to do what we can and do more. One of the things that just came through the chat that was also a next question is, and I know we're tight on time, but is there anything more that you could say about how employers can support their employees in this area?
Yeah, I saw the question and it was very specific to our insurance, I think, doesn't support mental health services. And certainly that's a challenge. And I would hope, folks would work with their insurers to try to figure out if there's ways to do that. But probably more importantly, if you can't do that, is to find ways to support people in the workplace. Over the last couple of years, in my departments, we've done things that I never would have considered. We're doing yoga on the clock during the day for folks. We have something called a soft landing where people can come once a week. It's just an hour Zoom. Anyone can drop in or out, and people just talk about what's going on with their day, or do they need support or help with something. And there's really just, look for those creative ways within your organization to support your employees. It doesn't always need a licensed professional. There are definitely ways that we can support each other in the workplace, creating supportive environments, working on stress reduction, time management, all of those things that add to the pressures of everyone's day. We all can help support each other with that. So be creative in your workplace and talk to your employees about what it is they actually need.
Mm-hmm. Thank you so much, Frank, for helping us understand a little bit about the challenges and also creative ways that we together can address some of the mental health needs. I have also seen a couple of things in the chat and other conversations happening around 3 other sectors that can help with mental health. One of them is the arts sector, right? So community arts partnership, theater groups, performance, creative, expressive arts are all connected in many ways to mental health, as well as peer supports like NAMI or the Mental Health Association, how people with lived experience, similar experiences can get together to support each other. And another area that some people connect with that can find helpful with this is also faith communities and spiritual practices. So there's a lot of opportunity for us to connect and understand more how we can support each other and ourselves. This is one of our Let's Talk meetings. Meetings is the wrong word. Let's Talk gatherings. Maybe we have an opportunity to have a conversation, look about certain kind of follow-ups, and go next steps. Thank you for being with us today. We have the next one scheduled on April 19th. with folks from the Tompkins County Human Rights Commission. May 10th, our own Janet Kotrach will be talking about resilient communities and some of the grant making we're doing. We'll do one of these a month. And we also have been involved with supporting and one of 2 lead co-sponsors with the Tompkins County Chamber that's starting a new process called Community Conversations to hold meetings and conversations in rural townships. And the first one of those coming up is March 18th in Trumansburg in the town of Ulysses. So there's a lot of opportunity in our rich, beloved community to connect with one another. So thank you, Frank, so much. And thank each one of you for making time with us today. Have a good rest of your day.